Many women continue to suffer in silence and intense pain every month due to their menses. To some, it is a normal thing that painkillers silence, while others dread the time of the month when their menstrual periods pay them a not-so-courteous visit. The torturing pain is known only too well by the endo warriors, a pain that cuts through the abdomen like a sharp sword. Hadassah Tripp is one of them.
I think for most of us, not everyone, the first trigger to go for, that sends you to a hospital is the pain. So I was in pain. When I see people talking about describing their period pains, I say, and they say, you know what, maybe you're just having normal cramps. I go like, endometriosis is painful.
Hadassah's broken look has been made beautiful by her courage and determination to find endometriosis. Sometimes she smiles at how life has changed as tears balance in her eyes when she looks back at where she has come from.
After years of struggle sharing with my parents, I was sent to a doctor the first time as a child in high school, but I was told everything was pretty fine. I remember taking painkillers, Panadol was my friend and all, but somehow the pain just persisted.
According to Dr. Basley Onyambu, an obstetrician gynecologist, there is always a high chance that the numbing pain associated with menses is an indication of endometriosis and it should not be ignored.
The distinguishing feature of the pain of endometriosis is that it onsets 2 or 3 days, sometimes even within the week before the onset of menstruation. That is the commonest symptom that people will present with in endometriosis.
Endometriosis is not a respecter of age. It is a condition that can affect even the younger generation. It has 4 main stages, the main symptom being pain, pain, and more pain. This happens either during the menses or 2 to 3 days before the onset of the periods. Various tests need to be done to diagnose this condition. Once diagnosed, management and a costly treatment begins. Sadly, the medication used and procedures have no guarantee of total relief.
As I mentioned to you, one of the treatments for endometriosis is hormone therapy. And the way the hormone therapy works is to suppress the regular menstrual cycle, in that there is no stimulation of the inner lining cyclically every month to shed as a period.
In the African setup, children are considered to be a top priority and a blessing in a marriage. Not having a child sees the society look at a lady with ridicule. Endometriosis is one of the culprits that steals this blessing. What is more important at this point is the all-round support system that one gets.
I mentioned that I run an organization called Waiting Rooms Trust. This organization creates awareness on matters in fertility and reproductive health. So part of our work is to go out and help, teach young girls on menstruation management and how do you take care of your reproductive health and all.
Apart from holding on to hope and praying for a permanent solution to this condition, Hadassah notes that insurance companies, including NHIF, should do more to make endometriosis treatment affordable and sustainable. For Switch TV, I am Sally Limo.